Hi, my name is Alisha Zaveri. I'll be your physician assistant student for today. I'm just going to be checking you out today and asking you a lot of questions about what's been going on just to get a better feel. Could I have your name?
Sure. My name's Darlene.
Darlene. And what's your last name?
Tulip, Tulip.
Great, thank you. And what's your date of birth?
My date of birth is November 8th, 1961.
Awesome. So what brings you in here today?
I've been getting these really random headaches that
no.
Yeah, they've been happening for about a month.
That's rough. I'm so sorry to hear that.
It's fine.
Before we get into the headaches, I'm just going to ask you a few questions about yourself, if that's okay.
Sure.
How old are you?
I am 58 years old.
58. What is your ethnicity?
I am white.
And what is your marital status? Are you married, divorced?
I am divorced.
Gotcha.
I got married, then I got divorced, then I got married again, and then I'm divorced, and I'm done.
Mm-hmm. Yeah, just done with it.
Yeah.
And what gender do you identify as?
I'm a female.
What do you do for work?
I work in a barbecue restaurant.
Ooh, cool.
Down on 45.
What do you do there?
I'm a line cook.
Oh, very cool. I check it out sometime.
Mm-hmm.
And do you have any significant past medical history? Anything you can think about?
My doctor always says I'm overweight.
Mm-hmm.
I don't really know. I've had high cholesterol
Mm-hmm.
since I was 40.
Okay.
My blood pressure's up because I'm 50.
Mm-hmm. Yep.
And I've just always been fat.
And how would you say your general health is? Would you say it's okay? Or?
I guess it's fine. I can get up and do my thing.
Yep. Gotcha. And have you visited any hospitals or clinics in the past 6 months before?
Mm-mm.
Nothing? All right.
I don't have the money for that.
Gotcha. Seems it's a time. So I'm just going to be asking you now some more questions about your headaches that you've been having this month. So where would you say in your head that you specifically feel the headaches? More towards the side or the front?
I'd say they happen right here.
Mm-hmm. Okay. And you said they started about a month ago?
Yeah.
Did it happen suddenly, or was it a gradual thing that they've been getting worse?
It was super sudden.
Oh, really? So you just started one day and then never stopped kind of thing?
Yeah. I got one, and it was just super weird. It was almost like I got hit on the head with a bat.
Wow.
Yeah.
I'm sorry to hear that. That sounds very painful.
Yeah, and I just, everything just kind of went numb.
Mm-hmm.
And I had to sit down, and I was at work, and it was lunch, and everybody thought I was faking it, and then it only happened that week once, and then the next week it happened twice, and then last week it happened 3 times, and I've had one every day this week, so yeah, they're just getting worse and all that, so.
Well, I'm glad you came in. We'll definitely try to fix that for you.
Mm-hmm.
So how long do they last when they start?
5 minutes.
5 minutes?
Yeah.
It's just all of a sudden 5 minutes and you're okay?
Yep.
Gotcha. And did you notice anything specifically happening right before you got the headaches?
No.
Nothing out of the ordinary?
Nope.
No trauma to your head, anything like that?
Nope.
Is there anything you can do for yourself that makes the headaches better?
No, because they come on so suddenly.
So no medicines, anything like that you've been taking?
Nope.
Is there anything that makes them worse when they come on?
Just not, sitting down.
Not taking rest. Got
Yeah.
it. Do they progress? Have they been getting worse for the past month, every day?
I guess, they don't get worse, they just become more frequent.
Frequency, okay. And have you ever experienced anything like this before?
No.
Nothing?
I've had headaches in the past, but nothing like this.
Yeah, makes sense. And how would you describe, the quality or, how the headache feels?
It's a sharp pain.
Sharp pain? Got it. And does it go anywhere else or just stays to your head?
It stays in my head.
Mm-hmm. And on a scale of 1 to 10, like how bad would you describe the pain of the headaches?
Like a 9.
9. I'm so sorry to hear that. You said it's just right there on your scalp, kind of.
And then it just, like I said, it kind of feels like I got hit in the head with a bat.
Mm-hmm.
It just it happens immediately, and then it's like my whole head.
Wow. Is there any time during the day that you like notice it happen more frequently?
I guess maybe like during times of stress.
Times of stress. Would you say you have a lot of significant stress going on?
I mean, yeah, like working in a restaurant is really hard.
Mm-hmm.
My son had to move back in with me because he is a heroin addict.
Mm-hmm.
Well, he's recovering, excuse me. And, you know, I got a lot of, like, stuff going on at home.
Mm-hmm. Yeah, sounds like a lot going on. So when you think about what's stressing you out, it kind of messes up your headache and everything?
It can, yeah.
Yeah.
But sometimes, like, it can be completely random as well.
Gotcha. Do you have any allergies?
No.
Nothing to food or, like, seasonal allergies, anything?
Nope.
Do you take any medications?
I just take birth control. My doctor doesn't want me off of it for some reason. I take the 28-day pack.
28-day pack?
Yeah.
Do you know the name of it?
No.
Do you know the dosage by chance, like what hormones you're getting? Nope.
Mm-mm.
Gotcha. So you've been taking that for how long?
Since I was 18.
Oh, wow. Pretty consistent, yeah. Cool. Okay. Now I'm just going to ask a couple of questions about, like, a little bit more about your headache and what's been going on. What is your usual weight?
Oh, gosh. I run about 240.
Have you noticed any recent changes in your weight?
No.
Have you noticed your clothes fitting any more tightly or loosely or anything like that?
No.
Have you noticed any weakness?
Nope.
Any fatigue?
No.
Any fever?
Nope.
Along with your headache, have you had any head injuries recently?
No.
Have you had any dizziness?
No.
Have you had any lightheadedness?
Yeah.
Feeling kind of like
Yeah, well, I like go numb on one side of my
Oh.
body.
numb on one side. Okay. And have you noticed any changes in your vision?
Yeah, when it happens, I go blind in one eye. The same
Oh.
side.
Which side? Is the left side or the right side? Do you know?
It's typically my left.
Okay. Left side. Do you wear any glasses or corrective lenses?
I wear glasses.
Mm-hmm.
But I don't think my prescription's changed.
Mm-hmm. When was the day of your last eye exam?
It was July 3rd of 2018.
Do you have any pain in your eyes?
No.
Any redness?
Nope.
Any tearing?
No.
Any blurred or double vision? I know you said you lose vision, but does it ever become blurred when it comes back? Or?
No.
Okay. Any spots or specks in your eyes?
Nope.
Any flashing lights?
No.
Any glaucoma?
No.
Cataracts? Anything like that? Okay. And then just some more questions about this. Have you had any changes in your mood recently?
No.
Any changes in attention or speech?
I do get slurred speech when it happens. My son
Slurred
told me.
speech? When you have headaches? Okay.
Mm-hmm. Yeah, when they come on, it's like everything just bottoms out.
Oh, wow. Must be scary.
Yeah.
Do you have changes in memory? Like, do you remember that you had these headaches when you did?
It's kind of fuzzy. The pain's just so bad that's,
Oh.
you know, and then once
Yeah.
they're gone, it's like...
So someone usually tells you that it, like, happened.
Mm-hmm.
Do you have any changes in, like, your judgment or insight? Like, has anyone told you would do anything differently or say anything?
No.
Okay. So you said you have headaches. So you said you don't have any dizziness?
Nope.
Do you have vertigo, like the feeling of, like, spinning?
No.
No, just pain mainly. Do you have any fainting? Like, do you ever pass out when you have these headaches?
No.
No? Do you have blackouts? Like, do you black out or not remember? Okay. Do you have any weakness when you have these headaches?
Like on the left side of my body, like, yeah.
Would you describe it as like a paralysis or like a numbness more so?
I'd say a paralysis.
Paralysis, okay.
I can't use it.
Gotcha. The numbness as well. Do you have any tingling or like the feeling of like pins and needles?
I get the pins and needles feeling in my toes and in my fingers.
Toes and fingers, okay. And then do you have any like tremors or involuntary movements of your hands,
No.
feet? Anything else? No. Okay. And have you ever had seizures?
No.
Okay. Great. So now I'm just going to be asking a little bit more about your past medical history from like when you were a child. I know it's probably going to be hard to like think back and all this stuff, but how would you describe your overall health as a child?
Fine.
Good. Any chronic illnesses?
No.
Nothing chronic? Okay. And then here's just a list of some illnesses we have to ask about if you've experienced as a child. Like if you remember any of these or experienced these, just let me know. Measles?
Nope.
Mumps? Rubella? Chickenpox?
Nope.
Whooping cough?
Nope.
Rheumatic fever?
No.
Scarlet fever?
No.
Polio?
No.
Diphtheria?
Nope.
Any psychiatric illnesses as a child?
No.
Now I'm just going to ask about your adult illnesses. Have you been diagnosed with anything?
No.
No.
Or wait, like I've been diagnosed with high blood pressure,
Mm-hmm.
high cholesterol.
Gotcha.
I don't take anything for those though.
Has your doctor recommended you take anything, or
No.
it's just kind of like at that level where you don't
Yeah.
need to? Gotcha. Do you have any history of diabetes?
No.
You said a little bit of hypertension. Any history of hepatitis,
No.
HIV,
Nope.
COPD, or asthma?
No.
Any thyroid disorders?
Nope.
Anything coronary related, like heart problems, anything like that?
No.
Any history of cancer?
Nope.
Any kidney issues?
No.
Any histories of any blood clots?
Nope.
Okay. So, have you had any accidents or injuries anytime in your life? Like,
No.
nothing, bones broken, anything like that? Have you ever been hospitalized, put in the hospital before?
No.
Nope. Have you ever had any surgeries?
No.
No surgeries. Okay. Have you ever been diagnosed with any psychiatric illnesses?
No.
Have you ever thought about harming yourself or others?
No.
Have you ever been hospitalized for anything psychiatric related, anything like that? Nope. Okay. Now I'm just going to ask about some immunizations. It might be like a little hard for you to remember, but just let me know if you think you've had these or if you know you haven't.
Okay.
So have you ever had the tetanus shot?
Yeah.
Pertussis?
Yeah.
Diphtheria?
Yeah.
Polio?
Yep.
The MMR vaccine?
Yep.
Have you gotten your flu shot this year?
Yes.
Great. Awesome. Varicella?
Mm-hmm.
Hepatitis B?
Yep.
Hemophilus influenzae B?
Yeah.
Pneumococci?
Yes.
Herpes zoster?
Yep.
Meningococcal?
Yep.
And the HPV vaccine?
Yes.
Cool, great. Now I'm just going to ask about some screening tests. Have you ever had a TB test, like a tuberculosis skin kind of test?
Yep.
How are the results of that?
Negative.
Have you ever been tested for HPV?
Yes. Pap smear.
Pap smear? And how are the results of those?
Negative.
Have you ever had a mammogram done?
Yes.
And how are the results of that?
Negative.
Negative? Okay. Have you ever had a fecal occult blood testing?
No.
No? Okay. Have you ever had a cholesterol check? You said you...
Yeah.
And it was a little high?
A little high, borderline.
Gotcha. So now I'm just going to ask about some women's health kind of history questions. How old were you when you got your first period?
13.
13. And it's been consistent ever since you still get your period?
Mm-hmm.
Okay. So, how long is your usual menstrual cycle?
About 7 days.
7 days. How would you describe your typical flow?
Heavy.
Heavy? So the birth control, I guess, has been managing that for a while, kind of
Yeah.
thing.
Mm-hmm.
Gotcha. And do you know when your last menstrual cycle was?
I actually have it currently.
You had it currently?
Yeah.
Okay. Have you ever missed a period, or for a long period of time, anything like that?
No, only when I was pregnant with my son.
Gotcha. Have you ever had excessive pain with your period?
No.
No. You said that you had a pap smear and it was normal.
Mm-hmm.
Have you had any history of sexually transmitted infections or anything like that?
No.
So you said you've been pregnant and you have had a son. Have you been pregnant any other times?
No.
Just once for your son. And was he premature or was he
Normal,
the right time, normal?
healthy birth. Yep.
Gotcha. Have you ever had any abortions or any miscarriages?
No.
No? Okay. And your son is still living and is still with you?
Yeah.
Gotcha. So now I'm just going to move on to some family history. So I'm just going to ask about... oh, sorry. So you have a mother and a father. Are they still living? Or?
Yeah, they're still living.
Mm-hmm. How about grandparents?
My grandparents are dead.
Gotcha. Okay. And you have one son?
Yes.
Does he have any children?
No.
Gotcha.
Thank God.
So I'm just... Do you know about any illnesses that run in your family, like any cancers, heart problems?
Yeah, my mom, she's 78. She has heart disease.
Heart disease. Any specific type that you know about, or just heart disease in general?
Just heart disease in general.
Okay.
My father, too.
So your dad has the same heart disease. How old is he?
80.
80, okay. Can you think about any other things?
My dad has diabetes, the kind that you get later in life.
Mm-hmm. Gotcha.
And my mom has blood clots. First one she got, she was in her early 60s.
Gotcha. Okay. Any histories of cancers or anything like that?
No.
Alright. I'm just going to ask about a couple more diseases if you can think about, just to ring a bell, anyone in your family who has any diseases, like your son or your parents or grandparents, siblings, anyone like that, let me know. Do you have any siblings?
No.
No?
Only child.
Gotcha. Do you know anybody in your family who has a history of any headaches?
No.
How about any seizures or seizure disorder?
No.
Any history of stroke?
Yeah, my grandmother, my mom's mom, she died when she was 68.
Died at 68 of a stroke?
Yep.
Gotcha. And how about any mental health issues or any history of suicide, anything like that?
No.
Any substance abuse in your family?
Yeah, my son, he is a former heroin addict.
Mm-hmm. It must be rough to go through, being by his side through all that.
Yeah.
Gotcha. Any thyroid diseases?
No.
Coronary artery disease?
Nope.
Any hypertension runs in your family?
No.
Any hyperlipidemia?
No.
Any diabetes in anyone besides your dad, you said?
No.
Asthma?
Nope.
Any tuberculosis?
Nope.
Any renal disease?
No.
Any arthritis?
Nope.
Any significant allergies?
No.
Any other genetic transmitted diseases?
No.
How old is your son?
32.
32. And so you said your maternal grandmother died of a stroke?
Mm-hmm.
How about your paternal grandfather or your paternal grandmother?
I never knew him.
No, your grandma or your grandfather? Neither of them on the paternal side?
Yeah, I never knew.
Both of them.
Any
Okay.
of them. Yeah.
And how about your paternal or your maternal grandma?
I never knew her either.
Okay. Gotcha. Great. Okay, so now I'm just going to ask about some social history. So if you could just let me know if anything comes up. Where were you born?
Bellefonte, Bellefonte, Pennsylvania.
Pennsylvania. Cool. How would you describe your childhood?
It was fine.
Fine, good childhood?
Yeah.
Okay. And what's your highest level of education?
High school.
High school? And you've been working at that barbecue restaurant ever since?
Mm-hmm.
Have you ever done anything else?
No.
Cool. And are you thinking about retiring? Any plans of that in the future?
Mm-mm.
Nope, just going to keep working?
Yeah.
Mm-hmm. How would you describe your home situation?
I live with my son and my dog, and it works. It works fine. It's okay.
Mm-hmm.
Yeah.
Do you have any significant stressors at home or anything like that?
I just put in a new septic tank. And that was expensive, but
Gotcha.
that's the only
Huge thing, yeah.
Yeah.
Your son living at home, everything's been okay with that so far?
Yeah.
He's recovering and stuff like that?
Mm-hmm.
Great. So your marital status, you said you were divorced. Have you ever served in the military?
No.
How would you describe your financial situation?
It's tight, but it's fine.
Mm-hmm. What would you say you do for fun? Or to relax, anything like that?
I like to watch TV with my dog.
Oh, that's nice. What kind of dog do you have?
I have a Yorkie.
Oh, that's so cute.
Mm-hmm.
So I'm just going to ask about some activities of daily living is what we call them. So do you have any trouble like showering or like dressing yourself or preparing your own meals?
Nope.
Anything like that? You do everything on your own?
Mm-hmm.
How did you get to this appointment today?
I drove.
Okay, so you're driving and everything?
Mm-hmm.
Great. Are you part of any religious or spiritual groups?
I'm like spiritual, but I don't belong to anything.
Do you go to church or anything like that?
No.
Okay. Do you exercise at all?
No.
No. All right. So what would you say you eat for breakfast every day?
An egg and toast.
Egg and toast. Any coffee or energy drinks with that?
A cup of coffee.
Do you usually have 1 cup of coffee a day or more?
Just one.
Just one? Okay, what would you say you have for lunch?
Whatever the barbecue joint's serving that day.
Mm-hmm.
Mm-hmm.
So you eat lunch at work most days?
Yep.
Great. And what about dinner?
We mix it up.
You cook most days, though?
I don't cook. My son cooks.
Your son cooks? That's nice. At least he does.
Yeah.
Takes care of that. Yeah.
Mm-hmm.
Cool. How much water would you say you drink every day? Like a good amount or like...
Yeah.
Yeah.
Like a few water bottles.
That's good. Do you drink anything else throughout the day? Like any energy drinks or sodas or anything?
No.
Not really? Okay. So your caffeine intake, you would just say you have like a cup of coffee every day?
Yeah.
Cool. How much would you say you sleep every night?
8 hours.
Do you have any trouble falling asleep or staying asleep?
No.
No trouble? Okay. Do you wear a seatbelt in the car?
Yes.
Do you wear a helmet if or when you ride a bicycle?
Yeah, I don't bike.
Mm-hmm. Do you wear sunblock when you go to the beach?
Yes.
Do you have smoke detectors in your house? And do you like make sure they're functioning every now and then?
Yep.
And your medicines and like chemicals, do you keep them locked or just kind of in your like house somewhere?
They're under my sink, but it's just my son and I.
Yeah, that makes sense. Do you participate in any alternative healthcare practices like massages or acupuncture or oils or anything like that?
No.
Nope. How much do you smoke?
I don't.
You don't smoke? Okay. How much do you drink?
I drink about 3 cans of beer per day.
3 cans of beer per day. Do you ever drink anything else?
No.
Nope. Do you usually drink that at night or throughout the day? Or
At night.
night, just to like kind of wind down and relax?
Mm-hmm.
Have you ever used any illicit drugs?
I'll use cocaine on like holidays and special occasions.
Mm-hmm. So how many times, I guess, a month would you say you use cocaine?
I'd say like 2 or 3 times a year.
2 or 3 times a year? All right. And we just ask all of our patients this. Do you feel like anyone is harming you or threatening you at home, anything like that?
No.
Okay. Okay, great. Now I'm just going to ask a little bit about sexual history. Have you ever had any history of STDs or STIs, anything like that?
No.
What would you say your sexual orientation is?
Like I like men.
Okay, great. And your sexual behaviors have just been with men in the past?
Mm-hmm.
How many sexual partners would you say you've had?
2.
2 sexual partners. All right. Okay, well, I guess those are all the questions we have to ask you. Next, we can move on to the physical exam whenever you're ready.
Okay.
Thank you so much for talking with me.
Great, yeah. And you were at 25, girlfriend.
Yeah.